Good afternoon. On behalf of the Association of State and Territorial Health Officials, also known as ASTHO, I would like to thank you for participating in today's webinar entitled The Unveiling, ASTHO's Newest Tools and Resources. My name is Denise Pavletic, and I'm the Director of Public Health Systems Improvement at ASTHO, and I will be moderating today's session. Today's webinar is brought to you through funding and partnership between ASTHO and the Centers for Disease Control and Prevention, Office for State, Tribal, Local, and Territorial Support. The content of this webinar are those of the authors and do not necessarily represent the official position of or endorsement by the Centers for Disease Control and Prevention. I am very pleased to be joined by two of my ASTHO colleagues, Joya Kaufman, she is the Director for Performance and Quality, and Carl Ensign, he is the Senior Director for Planning and Evaluation. And as I indicated, I will be joined by them in today's presentation. Our webinar objectives for today are to provide you with the information you need to access and use ASTHO's accreditation resources. Our newest resources include our Customer Satisfaction Toolkit, Strategic Planning Toolkit, the State Health Assessment Guide, and our QI Plan Toolkit. At the conclusion of the webinar, you will be directed to a link to answer a few questions on how well we have met these objectives. In the spirit of our own QI, we very much value your feedback, so please take a few moments to complete the evaluation. We are very excited to bring you today's webinar, and we look forward to a robust Q&A session at the end of the presentations. If I could take just a moment to orient you to our ReadyTalk platform, there are two ways in which you can submit your questions. The first is through the chat function located on the lower left corner of your screen. You can submit questions at any time throughout the presentation using the chat function. The second option is to hold your questions until the end of the presentation, at which time our operator will open up the lines for you to address the presenters. And then if I could also take another moment to orient you a little bit to where you can find these new resources. I have put before you a screenshot of our ASTHO homepage, and you would get there using www.astho.org. And if you hover your cursor over the programs, a drop-down menu will appear, and then you will click on the Accreditation and Performance link. And then what you see before you now is our Accreditation and Performance landing page. And towards the middle, you'll see a resources. Underneath the resources, there's a link to our Tools Clearinghouse, and that's where you will find the resources that you'll be hearing about today. I did want to mention that we have several resources in the clearinghouse, including case studies, toolkits, peer network information, our Quality Connection newsletters, webinars, sample state health assessments, state health improvement plans and strategic plans, presentations and fact sheets, and an accreditation library where we house example accreditation documentation by standards and measures. And then, as an example, if you were to select the QI Plan Toolkit, what will pop up before you are able to download the toolkit is this screen here, which will ask you for your name, which is a requirement. The agency name is optional, and then your email address. And just to clarify, the reason that we are asking for that information is for us to be able to use that in our evaluation of these toolkits. So without further dialogue, I'm going to pass it along to Carl and let him talk about the Customer Satisfaction and Strategic Planning Toolkits. Carl, go ahead.
Okay, thank you very much, Denise, and thank you everyone for joining us today. It's really exciting to get these resources out there. We talked some about them at the Open Forum here recently, and there seems to be a lot of interest in them, so it's good that we can provide something of use, and we're very interested in a dialogue about how these could be improved or other toolkits going forward. So keep that in mind as you're viewing this. I'm going to be talking to you today about two toolkits, one which is currently available, that is the Customer Satisfaction Toolkit, which is available currently on our website, and the Strategic Planning Guide, which we are just in the process of doing the final formatting edits. I got an email on it this morning, as a matter of fact. So we're in direct communication with the folks who are laying it out, and just in the final stages of wrapping that up. So by this time, certainly next month, probably early next month, the Strategic Planning Guide will be on our website as well. So first, let's talk about the Customer Satisfaction Toolkit. The question I get most frequently, a lot of folks are out there who are very savvy about conducting customer satisfaction surveys and getting feedback from customers, but there's also folks who just know that they need to do it, and so they want a survey and want to pick my brain on which survey they should use and how they should use it. So if you'll note here, we have a total of 9 steps for thinking about and conducting a customer satisfaction effort. And I think 1, 2, 3, 4, 5, 6, you come all the way down here. Step 6 is design a survey, prepare questions, and select survey scales and survey format. So there's a lot of work that needs to go in, not a lot of work, but a fair amount of work that really needs to go into thinking through the purpose of the survey, the program or set of programs to be measured, how the results will be used, identifying people to include in planning and administrative tasks before actually hitting the field. Those folks who did this said that the worst area you can really commit is by going out into the field too soon before you've thought through the purpose of your survey, for what ends you're going to use it, and really thinking through how it should be designed and carried out. So actually with both these, let me just stop there and say with both these presentations, I'm taking primarily screenshots from the toolkits. It's not in any way going to be an exhaustive look at these two toolkits. You may even not be able to read it all, but that's not really important. What I'm trying to do is give you a flavor for the purpose, content, and intent of these guides rather than walking through them in any depth. I think they will both are available in hard copy and electronic. There are certain advantages to the electronic in that there are links that are live with the electronic, but you can request hard copy as well. So anyway, 9 steps. Let's look at step 1. And so over here we have several different purposes that we have found that when we talked with states out there, states and localities that have used customer satisfaction, have collected that information and used it, several different ways that they have gone about that. And then what we have over here, actual surveys, examples that are in the field, so that you can click on any one of these and see how Florida is monitoring customer satisfaction with services at an overview level that can be applied to a range of activities. So in fact, if we go to Florida's example, which I'll give you a screenshot of that, you have what you see here is a template, if you will, a generic satisfaction survey where the customer would fill out their location and their program, and then Florida wanted to know certain essential information across all its services that have to do with accessibility, clarity, courtesy, knowledge, helpfulness, timeliness, and overall satisfaction. So we provide an example of Florida's, and that's just one example up here under monitoring customer satisfaction with services and activities at an overview level. We have specific programs here. That would be another purpose if you're interested in how hazardous waste, what customers have to do with have to say this, hazardous waste, etc., monitoring and following up with specific customer complaints, asking stakeholders, including local health departments, to provide feedback on collaborative activities or state services. Often the customer can be your regional office, for instance, or your local office. So thinking about customer in that way, we have examples of that. So that's just step one, where we have identifying your purpose, and then some examples of different purposes that folks have identified when they look at their surveys, and examples of surveys. And so the guide walks you through each one of those steps. So here's step 5, for instance. Frequently overlooked step in all evaluation efforts: identify people to include in survey planning and implementation. So you want to think about the customers you're going to be assessing, their satisfaction with your programs, services, or their experience in interacting with a particular facet of your organization. Perhaps you want to involve some of them in thinking through the questions that will be asked, so that we can make sure that they're understandable and clear and usable. The end users of the analysis, so the program directors who are going to be running with this information, or policymakers, decision makers, including them in your planning. And don't overlook the technical experts, those who are savvy and have administered surveys before, survey design, how the data needs to be collected so that it can be analyzed at the end. So that's just another example of kind of some helpful lessons we found from the field. Step 6, when you actually get to designing a survey, here's a list of issues that we found that we've all experienced probably when we answer those online survey questions, that the survey is not short enough and we get irritated at that. Or we don't really understand the question, or the question is asking 2 things at once. So throughout we have illustrations of how states have used and applied their survey findings and lessons they have learned. Here's another interesting and useful table that we developed for step 7 when you're selecting a survey method. So up here you can go at this through a mail survey, email, or web-based. That's SurveyMonkey, for instance, is a readily accessible tool at a low cost that you can provide folks that you want to respond to a customer satisfaction with an email link. So just taking that example, the response rate may be moderate in that it might be really higher if you engage people on the phone, for instance. The speed with which you can get the results is nearly instantaneous, since you can click on the survey and see the analysis conducted for you. Cost per completed survey is very low. Anonymity, because you're giving out email addresses and having people respond, may or may not be. A telephone survey, of course, the response rate would be very high, the speed fast, but the cost is very high. So tables like this just provide some of the trade-offs that are involved with selecting a survey method. Okay, so that's the snapshot or high-level overview of customer satisfaction. If you have any questions at the end, I'd certainly be happy to answer those. If you want to write them in the chat box, we'll be monitoring those as we go along. The other guide I'm really excited about, which is a little bit lengthier and has been a little more challenging simply because of its complexity, is the Strategic Planning Guide, which we will be publishing on our website next month. So let me just provide you, kind of give you a walkthrough again with some screenshots about what that is aimed at and the approach it takes, because there are any number of ways to approach strategic planning. So one way, and pay no attention, this is a screenshot, pay no attention to this text here on the left. You may or may not be able to read that. But this framework is one useful way of thinking about strategic planning and the processes involved. So at its foundation, if you will, are our mission, vision, values, which we really need to define before we start undertaking strategic prioritization. So this actually is when the planners get in the room and start developing a plan. They're involved with this activity here. What we're saying is there's some important mission, vision, values, and basic groundwork that needs to be done in order to make this fruitful and targeted. And then this may be fairly high level, these strategic priorities. We give examples of different strategic mapping and different techniques that are used to provide these at an overview level, we're going to need to follow up with some more in-depth work plans to really lay out tasks and activities and responsibilities and completion dates. And then finally, the strategic planning process is really incomplete unless we follow up with a performance management system. So we provide some insights on how to do that. I should say with this strategic planning guide, got a week or so into it and found that the NACCHO website had an excellent planning guide developed by Lori Call and other folks over at NACCHO on their website. So quickly we sought to not duplicate that strategic planning guide, but kind of build on some of the basic lessons learned and frameworks that it set forth, and provide some state examples and some greater depth in a number of areas, especially the evaluation and monitoring progress stage. So here's another way, and it's nice that Joya will be talking about some of these with some other guides, but how the strategic plan, which you see down here, fits within the state health assessment, the state health improvement plan. So basically what you have is you have public health down here, and as you all know, the state health assessment and the state health improvement plan, which is one of 3 prerequisites along with the strategic plan for accreditation. The SHA and the SHIP, or the CHA and the CHIP, depending on if you're at the state level or community level, are meant to be very broad, involving our partners along with public health. By the time we get into the strategic plan within accreditation, and we built both these guides within the accreditation framework, we're talking about public health's role in fulfilling the SHIP and the SHA. So this is one helpful way of thinking about that. And then you have your quality improvement plan, you have your strategic implementation plan for the strategic plan, you have other plans, you have division work plans, you have employee performance plans. So there's alignment that needs to go on here within public health, and there's alignment that needs to go here across partners. And we spend a bit of time thinking about that. And these may not happen sequentially, which means we'll have to cycle back and kind of adjust the SHA if we're undertaking a strategic plan to make sure they're all in alignment. One other framework that really provides the basis for this plan, and again, you probably can't read all of this, but I just wanted to give you a screenshot. This is the strategic planning cycle, which is iterative, and these are the actual steps that the strategic plan focuses on in the text. So organize. Select the strategic planning committee responsible for overseeing plan development and structuring the process. We spend a good deal of time talking about how states organize themselves in order to undertake strategic planning. Mission and values. How you go about developing those and some examples. Scanning the environment through a SWOT analysis, strengths, weaknesses, opportunities, threats. The public health agency does not exist in a vacuum. So thinking about those externalities and those internalities, internal factors that will ultimately help us strategize moving forward. And this is where we start developing the strategic plan, developing those detailed work plans, and then putting them into implementation and evaluating and revising as necessary. So the strategic planning guide walks through in some detail each one of these steps. So here, here's a screenshot of how we handle the accreditation requirements. At several points in time, we take individual measures and we talk about the documentation that's needed, the data and guidance, and we provide examples of those over here. And those appear at multiple points throughout the strategic planning guide, so that this will help you meet the accreditation requirements if that is your goal. Here, skipping over to mission, vision, values, we have our orienting pyramid so we can see where we are. We're here in the foundational phase. Here are all the mission statements that we found, what a mission statement is, what a vision statement is, how the two are different, and some samples from various states are provided. So it's what we try to do in the strategic planning guide is provide you a conceptual framework of where you are and some examples drawn from the states that we talked with. Moving towards the end in terms of developing a strategic plan, here we have California's strategic map, a useful framework that we use here at ASTHO for really providing a one-page graphic of your strategic plan. We spend some time talking about that and describing it, although it is only one approach to developing a strategic plan. In this particular example, we have California's strategic map with what they call its central challenge here, leverage key opportunities. Its vision and mission appear up here, needed for accreditation that we build on its solid foundation. Strategic priorities here in these A, B, C, D, and E, and then the objectives that need to happen under each one of those. Certain of these are highlighted. Those are the ones that California has chosen to focus on immediately as kind of first priority. So it's interesting here in that you look at achieve targeted improvements in health outcomes and strengthen the department as an innovative, high-performing organization. We follow that through to a performance management system where again you see achieve targeted improvements in health outcomes and the strengthened department. We look at the strategic objectives they put in place with that and the performance measures, and we walk through the California example of developing a performance management system, which would bring you full scale back to the evaluation and needed revisions down the road as you implement the strategic plan. So with that, I think at this point I will pass the baton. Thank you very much.
Thank you, Carl. And so the next toolkit that we will be addressing today is our State Health Assessment Guide. And I did want to mention and sort of piggyback what Carl had mentioned earlier is that although the content is different for each of these toolkits, we really made a concerted effort to make sure that the toolkits had a similar look and feel. The toolkits reference not only one another, but they also reference the FAB standards and measures. We've provided many, many links to various resources within each of these toolkits. And so as Carl mentioned, it is it's to your advantage to use the toolkit on the website so that you have those active links that you can click and go. Okay, so in terms of the State Health Assessment Guide, this was a joint venture between ASTHO and our colleagues and friends at the Illinois Public Health Institute. Work began for the State Health Assessment in March of 2013 and wrapped up approximately March of 2014. So there was a lot of time and effort that went into this. We feel like this is a really robust resource. And then, of course, this project wouldn't have been possible without our subject matter experts, and we assembled an advisory committee consisting of the folks that you see listed there on your screen. We are very grateful to them. They worked very hard over the year to help us come up with this resource. So the approach that we took was that we did a public health systems research. We performed a public health systems environmental scan, essentially. We identified best practices from public health sector as well as other fields. And then, of course, we used the experience of states that have already conducted a state health assessment. And then all of that information was vetted through the advisory committee. We had input and feedback as well from ASTHO, subject matter experts, and then again our colleagues at CDC. And I do want to mention that the state health assessment is designed to assist states in launching either an initial state health assessment or to help them improve their next one. And of course, the State Health Assessment Guide specifically addresses the requirements in the FAB standards and measures, specifically FAB Standard 1.1. However, it can be used to complete a state health assessment regardless of a state's intent to seek accreditation. There are 4 modules within the state health assessment. identifying and engaging system stakeholders, collecting and analyzing your health status data, collecting and analyzing stakeholder and community input data, and then finally summarizing, presenting, and communicating those findings. And so within each module, we have a module overview, and my slides are similar to Carl's in that I took screenshots from within the guide. So it's not really important to be able to read what's on there, but just to know that each module does have a module overview. And then there are sections on the key content and components. Of course, as I mentioned earlier, there is reference to the related FAB standards and measures, not only the standards and measures, but as it relates to the FAB guidance as well. And we have tried our best to include as many, again, resources as we could. Again, that was based on feedback from the field. So you see here we've included checklists, we've included tips within the guide, and then of course links to important resources. And so contained within each of those modules, you will find all of those various aspects. So at the end of the day, this is what the State Health Assessment Guide will provide you. It will provide you with partnership, coalition, or a committee engaged to lead the process, a profile on the health status data for the state, findings related to health disparities and inequities, an analysis of community and stakeholder input about important health outcomes, identified resources to address those health outcomes, or excuse me, to address those health issues, and then a plan for disseminating and seeking public and stakeholder input on key findings. And so before I pass the baton over to Joy, I just wanted to mention that we do acknowledge that the process for conducting a state health assessment and creating a state health improvement plan are linked, and that system stakeholders are typically engaged in one continuous process that includes both the SHA and the SHIP. And the SHA process itself is a set of interconnected assessments and stakeholder engagement activities rather than a set of linear steps. And so because of this, we are recommending that you at least scan the entire guide before embarking on the process, because there may be aspects that you have already completed within your state health agency. So again, building off the State Health Assessment Guide, coming in at the end of this year, we will be offering a state health improvement planning process. And so we're very excited about that as well. So the two resources will be very much interconnected and referencing one another and building off of one another. So that's all I have on the State Health Assessment Guide, and I'm going to turn it over to my colleague, Joya Kaufman, to talk about the QI Plan Toolkit. Joya?
Yes, thank you, Denise. Good afternoon, everyone. As Denise mentioned, my name is Joya Kaufman, and I'll be sharing information about ASTHO's Quality Improvement Plan Toolkit. This publication contains guidance and resources to assist state and territorial health agencies in developing an agency-wide QI plan. So over the next few moments, I'd like to share information about the purpose of the toolkit, provide insight as to why it was developed, describe the development process, and briefly review the content and resources in the various sections of the toolkit. So before we talk about the purpose of the toolkit, I'd like to preface it with why. Why does ASTHO create this resource? As many of you are aware, over the last 10 years, improving public health agency accountability and performance through improving infrastructure has been a major focus at the national, state, and local level. Typically, a QI plan describes what an agency is planning to accomplish and reflects what is currently happening in regard to QI processes and systems within that agency. A QI plan is critical is a critical guidance document that informs everyone in the organization as well as outside of the organization as to the direction, timeline, activities, and importance of quality and quality improvement. And since a QI plan is typically a living document, it should be revised and updated regularly as progress is made towards priorities and as priorities change. The QI plan provides written credibility to the QI process and is a visible sign of management support and commitment to quality throughout the health department. So in that sense, the QI plan directly fulfills the increased emphasis on agency accountability and performance. So a little bit more back to the why. Since the QI plan is such a critical guidance document for health agencies, there are dozens, if not more, resources about QI planning, QI projects, and QI tools in the field. However, to date we were unable to find a standalone resource that addressed the comprehensive development and sustainability of a QI plan with tools and resources and templates all in one central place. So given that background, ASTHO decided to pursue creating this resource pretty much as a benefit to our members and those who are in a health agency and are tasked with writing and implementing a QI plan. So the purpose of the QI plan toolkit is really twofold. The first is to provide a framework and guide for state and territorial health agencies to develop an agency-wide QI plan. Any state or territory that's in any stage of creating a QI plan can use it. For example, agencies that are just starting out to prepare for the QI plan may find it useful, as well agencies who have completed a plan and are revising it perhaps will find the toolkit helpful in making sure that there is some content and elements that they can consider including during their revision. The second purpose is to facilitate preparation for FAB accreditation. For agencies that are interested in applying for accreditation, the toolkit addresses the documentation requirements specifically in 9.2.1 as well as 9.2.2. Throughout the document, just like in the state health assessment, we made a deliberate effort to highlight where FAB has provided guidance on a particular element of the QI plan. So overall, the guidance in this toolkit should facilitate the development of the QI plan, but agencies should be prepared to adapt the guidance as needed to fit the particular needs of their organization, because as we know, there's no one right way to do it. So how this toolkit was developed. Let's see. This toolkit, as many of ASTHO's resources, was funded through the Centers for Disease Control and Prevention. The toolkit is the result of a collaborative effort between the North Carolina Institute of Public Health and ASTHO. The Institute prepared the toolkit, and ASTHO developed the strategic direction and facilitated connections at the state health agency level. It's very important to note that the toolkit was developed after intensive research and review of the field, as well as feedback on draft iterations of the toolkit. The North Carolina Institute of Public Health conducted reviews of existing state health agency plans, as well as QI planning literature. They also reviewed state health agency staff and quality improvement consultants. And so the development process can be seen on your screen, steps 1 through 6. The final toolkit is a result of a comprehensive process that included research, review, and input from our members. So before we get started about the sections of the toolkit, I'd like to point out some very important features that you will see throughout the toolkit, and they'll be very similar to what Denise and Carl mentioned. Each section, as well as the subsections, contain purple call-out boxes entitled Relationship to FAB. You can see that on your screen. These boxes are again intended to remind the reader that the step or content that is in the toolkit aligns with the requirement. the requirements of QI planning or a QI plan as determined by FAB. At the end of each section, you will also find a yellow box entitled Tools and Resources. This contains hyperlinks to downloadable forms, templates, and worksheets that you can print out and use during your QI planning process. There's also a light purple tick box that contains quotes from QI consultants and agency staff, as well as examples. The purpose of these quotes and examples is really to address the how and give suggestions on realistic and practical approaches to what the toolkit is suggesting. Next, I will provide a brief overview of the sections within the toolkit. The toolkit is organized into 6 separate sections. The first provides a checklist and key resources to refer to when developing a QI plan. The second sets the stage for creating a QI plan by providing information to consider before writing the plan. The third consists of information and resources for each of the 10 suggested QI plan elements. The fourth section includes the links to existing QI plans from state health agencies who have agreed to share them with us, as well as QI plan templates and guidance. The remaining 2 sections provide resources and references. So on your screen you can see a shot from section 1. So there's no standard process in developing a QI plan. The state health agencies that were interviewed used different approaches to develop their plans, but based on their experiences and QI consultant feedback and QI planning literature, we recommended a list of, again, 10 suggested steps for building a QI plan. While the steps don't need to happen in order, the first 5 should be considered before writing a QI plan, and the remaining steps can be used as you plan, implement, evaluate, and sustain your agency-wide QI plan. As I mentioned, Section 2 sets the stage for creating the QI plan and gives information on the topics of before writing the plan, the importance of an agency-wide QI plan, a quality system, leadership involvement, and the FAB standards and measures. Again, several different tools and resources are dispersed throughout the section. I've included these to the right. For example, there's a presentation on QI culture. There's a performance management position statement, model for performance management, a roadmap to culture of quality, and several other resources. Of note, within this section, there's a table highlighting all of the areas where the QI plan is referenced in the FAB standards and measures. The FAB Domain 9 focuses on the evaluation of programmatic programs and interventions, including key public health processes and the implementation of a formal QI process. However, FAB has incorporated the concept of continuous QI in its standards and measures. So this table just shows the different places where QI is mentioned outside of 9.2.2. All right, so Section 3, we really consider this to be the meat of the toolkit. For each of the 10 suggested elements, which we have we have put letters rather than numbers, A through J, there's a description and key information on the element and its relevance to the QI plan and FAB measure. Where possible, tips, examples, and resources gleaned from state health agency or QI consultant interviews are provided. For many of the elements, downloadable action plans, worksheets, and checklists are included to aid in your planning. You can see the different QI plan elements on the list to the left. The next is just a screenshot of some of the resources that we have in there. This one is a picture of a QI steering committee. It gives the structure as well as a charge and how this committee will function. There's also additional tools. On the next slide, you can see a project prioritization and selection matrix. This can help your QI committee to select projects based on different factors and variables. Some more resources that are in this section. On your screen, you can see a simple 18-month implementation and monitoring approach that you could use for your QI plan. So in Section 4, we've included hyperlinks to state and local health agency QI plans as well as QI plan templates. So during this process, several agencies, including two, which will be Washington and Oklahoma, agreed to share their QI plans with us. So all the plans listed here encompass a range of styles and content matter, but they can provide a few examples about how to create a QI plan, and you can adapt them to your needs. In addition, we've also included a few local health department QI plans because those can also be helpful. Several organizations and authors have also created templates or guides to facilitate the development of the QI plan. We've listed those and included them within the toolkit. And so just to wrap up, in Section 5 and 6, we've included a resource list, which includes an overview of key resources identified by state health agencies and QI consultants as helpful during their QI plan development. And then there's also the section references, which provides the reference to different things that we've included in the toolkit. So with that, I've reviewed the purpose, background, and development of ASTHO's QI plan toolkit. We really consider this toolkit to be something that is made by you and for you, and we're very pleased about the input and the engagement of our members throughout the process. So we hope that this is a robust and useful, toolkit for everyone that uses it. And so we're open to feedback. Again, as Denise mentioned, we might be reaching out to you to do some evaluation efforts, and as always, we'll be updating the toolkit based on your needs. So at this point, I will turn it over to Denise, or the operator, for questions and discussion.
Thank you, Joya. So I'd like to thank my fellow ASTHO colleagues for taking the time today to orient our participants to the latest toolkits and resources. And so as Joya mentioned, we would like to open up the line for questions. So Melissa, can you open up the lines?
Yes, thank you. Ladies and gentlemen, if you would like to register a question, please press star followed by the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key.
And so while we're waiting for Melissa to queue up those questions, I did get a couple of great questions here over the chat function, one of which asks, are these resources based on the FAB version 1.0 or version 1.5? And so I'll pose that to both Joya and Carl.
Yeah, thanks, Denise. I'll jump in here first. We did use version 1.5. There really weren't a lot of differences, quite frankly, in either the customer satisfaction or strategic planning arena in terms of requirements, differences between the two, but we did go with 1.5.
Joya, how about the QI plan toolkit?
I would have to concur with Carl in terms of the 1.5.
And so to answer the question around the state health assessment, because that process and resource was started last year prior to version 1.5 coming out, it was based on version 1.0. However, I will say that, in terms of comparing the two, there weren't any substantive changes in terms of the requirements. So you should be fine in using the State Health Assessment Guide. There may be some nuances in terms of the guidance that's provided. Version 1.5, as you know, is the focus was to provide much more clear and concise direction for the documentation. So there really would not be any substantive changes between 1.0 and 1.5 in terms of the requirements for the SHA. So thank you for that question. So I'm going to turn it back to Melissa. Do we have any questions over the phone?
There's no audio questions at this time.
Okay. So here's a question through the chat function for Carl. Carl, you mentioned that the strategic planning guide has not been made available yet. Do you have a timeline for that?
Yes, so we're looking to wrap up with the formatter. We're in the final formatting stage and making sure all the links are working and that sort of thing by the end of the month. So then we're going to post it on the website as soon as we can. So certainly by this time next month, it'll be on our ASTHO website. We're aiming to have it in early to mid-July at the latest.
Okay, great. Thanks, Carl. Melissa, I'm sorry, Melissa, was there any, let me go back to the phone lines and see if there's any questions queued up.
To ask an audio question, please press *1.
Denise, this is Carl. I think we do have another question from Janice Taylor, I see, with respect to QI Toolkit. Any thoughts given to aligning with lean methodology?
Hi, thanks, Carl. So I think that in the toolkit, you can see that what we try to do is we address QI methodology. There's a section dedicated to different processes, which includes plan, do, check, act, lean, rapid cycle, but there isn't, we offer them as options, and we give examples of how different states have used different processes, but we have not chosen to align specifically with lean because we know that certain processes will work in certain environments, but you have to choose the one that's best for you.
Okay, great. Thanks, Joya. So I will ask one last time, Melissa, any questions through the phone?
There's no audio questions at this time. Okay,
so we did plan for a 45-minute webinar, so it looks like we are out of time. We once again want to thank I would like to thank the presenters as well as our funders and of course our participants for being here for the discussion on our newest resources. If you need any further information about anything addressed today or on topics that are related to accreditation and QI, you can contact me directly at the email address listed on the slide, and then I will route that to the most appropriate person, whether that's Joya or Carl. Once again, we value your feedback, so please take a few moments to provide us with your feedback on today's webinar. Once we close out the webinar, you will receive a link where you'll be asked to provide us your feedback. So thank you, and that concludes today's session, and we hope you have a great day.